Okay, thank you. So we'll begin the public testimony. And as I said before, we only have just under 20 minutes on each of the bills that are left. And of course, this has not been the first hearing on this subject. So we'll begin with, we'll just go in order until we run out of time. Jim Cooper, Robert Hill, Randal Lewis. Who would like to begin?
Happy to, Senator Murray.
Okay.
I'm Jim Cooper. I'm the president of the Washington Association for Substance Abuse and Violence Prevention. Thank you, Senator Murray and members of the committee. I'm handing out to you 3 articles from the Denver Post that talk about their system that they have in Denver and how it has actually increased youth access. And that is our #1 concern. We applaud your attempts to create a system that works for the state of Washington so that patients can have access to their medicine. But we have some concerns, and you'll see a copy of an email that I sent to you all about a week ago outlining those concerns, so I'll be really brief about them. Since 2003, as the conversation about medical marijuana has escalated in this state, we have seen a decrease in youth perception of harm, and that's gone down 20%. So kids think that marijuana is less harmful, and their use rates since 2003 have gone up 10% as we've continued this conversation. In fact, chemical dependency programs in our state, the #1 thing that youth go to treatment for is marijuana dependency. So with that increased access, we also are seeing increased youth use in our communities. We have 3 solutions to help this if you must go forward with this bill. We'd like to see regulations on advertising. We know through our work with alcohol that advertising affects youth use, and I'll show you this Northwest Medical Guide to Medical Marijuana from the Stranger, which actually uses sex and drug culture to sell marijuana and talks about how you can get a medical marijuana authorization if you want one. So regulate advertising, treat medical marijuana like a prescription drug and put it in a pharmacy like all other prescription drugs are currently in Washington state. I don't think we would want to see dispensaries for oxycodone or Percocet. And then lastly, please change the regulations around designated providers and growers to mandate that they be 21 or older. Thank you.
Thank you. Next.
Shalom, praise Jehovah. Good morning, Mr. Chairman, members of the committee, staff, and honored guests. My name is Hill. I'm here as a private citizen. I'm not a patient. I'm not affiliated with any dispensaries or gardens or co-ops. I am familiar with some of those individuals. Section 8 of this bill establishes a registry on page 14. It is voluntary. There is some flyer that's been going around relating to not having one. I bring your attention to the language on the bottom. This section doesn't establish the registry until January 2013, and so there's no patient protection until January 2013 at the earliest. And my concern is that we have patient arrest protection now. And there's 4 choices that this committee can take to amend this bill. One is to add an emergency clause and amend Section 8 to say perhaps August. That's choice #1. Choice #2 is to temporarily legalize cannabis until January 2013. Amend Section 13, which deals with the sales tax removal, allows sales tax to remain. If a patient fails to present ID and authorization when they purchase cannabis, they have to pay the sales tax. They have to get a refund for later if they choose to, or if they show it, then they don't pay the sales tax. Option 3 is to add a clause that has a lowest enforcement priority paradigm in it, which is similar to, which would implement what Seattle voters addressed a number of years ago, and Tacoma voters are considering addressing this year. The 4th item is to simply require only 2 items to have arrest protection: a piece of paper and a card. The card would be ID. That concludes my remarks.
Thank you. Next.
Mr. Chair and members of the committee, Randal Lewis, Government Relations for the City of Tacoma. The City of Tacoma has been involved in this issue from the beginning of the legislative session for one reason. We have current situation in Washington State is chaos in our communities regarding people not knowing whether how they get the access to this drug that the voters said they have the right to get. and to our local law enforcement community who doesn't know where these dispensaries are, and now, as a result of the veto of 5073, we now have authorized collective grow operations that are completely unregulated as a result of the veto. So we have a situation where we are pressed with, you have to address, in order to end this chaos that exists in communities regarding, we've always said from the beginning that the dispensary model was, we didn't care how you created order out of the chaos. We just wanted you to do it. This approach now, which the governor has said she can support regarding the cooperatives, works just as well for us because they're regulated, we know where they are, and this also then provides us with the regulations for the collective grow operations, which don't exist clearly in the current law as a result of the veto. So we encourage you to act on this legislation to end the chaos that exists in our communities, not only for the patients, but for local government as well. Thank you.
Thank you.